Life ends suddenly, the heart, it almost always holds the final answer. But that answer? It's written in a language of tissues and vessels and valves. So today we're not just looking at a medical procedure. No, we're joining a forensic investigation to learn how to read the story a heart leaves behind.
And that's really the big question, isn't it? If this heart could actually talk, what would it say? Every single one holds clues. Clues to disease, to an injury, to the exact moment that everything went wrong. So our job is to follow that evidence, to uncover the truth that's hidden deep inside.
All right, so just like any real investigation, you don't start by kicking down the door. You start on the outside, at the perimeter, carefully looking for those first crucial clues, anything that just doesn't seem right.
And the very first move is to open up the pericardial sac. Think of it as the heart's own protective little bag. What's inside this sac can be a massive clue right off the bat. Is the fluid in there clear, or is it full of blood? That one observation can send the whole investigation in a totally different direction from the get-go.
So what's normal? Well, you should find about this much clear fluid, around 10 milliliters. It's not a lot. Way more than that, or if they find blood, well, that is an immediate flashing red flag. It points to a possible rupture, and believe me, the alarm bells are already going off.
Okay, so with the heart out, the external exam keeps going. They'll check its size, look at the amount of fat on the surface, which can tell you a lot about its weight and how well it was working. And they also feel it. They're checking for a strange crackling sensation under the surface. It's called crepitation, and it's a huge telltale sign of a deadly air embolism. Basically, a trapped air bubble that can stop everything cold.
And now we go inside. But this isn't just random cutting. The dissection is incredibly systematic. It's designed to meticulously follow the natural path that blood takes through the heart. The whole point is to find out exactly where and why that flow came to a fatal stop.
So the journey begins on the right side of the heart. This is where all the deoxygenated blood comes back from the body. An incision opens up the right atrium, and from there, traces the blood's path, down through the tricuspid valve, into the right ventricle, and then up and out towards the lungs. Every single chamber, every valve is inspected one by one, in perfect order.
Now, when they're inspecting those valves, have a surprisingly simple but really effective way to measure them. I want you to remember this number, 3.
See? It's a simple physical check, but it reveals so much. A healthy tricuspid valve, that's the one between the right atrium and the right ventricle, it should be wide enough for 3 fingers to pass through. If it's any narrower, it could mean a condition called stenosis has been silently making the heart work way too hard for years.
Now we move on to the left side of the heart, and as you'll see, we follow the exact same methodical logic. The left atrium gets opened, the mitral valve is checked, and the incision follows the path of that fresh, oxygen-rich blood through the super powerful left ventricle and out the aorta to the rest of the body. It's the other half of the circuit examined in the very same way.
And just like we had a key number for the right side, we've got one for the left. This time, though, it's 2.
The mitral valve is just naturally a bit smaller than the tricuspid. It should let just 2 fingers through. So you have this really simple, almost foolproof comparison. 3 fingers on the right, 2 on the left. An instant, hands-on feel for the heart's basic and correct anatomy.
So far, we've been looking at the big structures of the heart, but now the investigation gets microscopic. We are officially hunting for the smoking gun in so many sudden cardiac deaths, a blockage in the coronary arteries, those tiny little vessels that actually feed the heart muscle itself.
And the number one suspect is what's called an antemortem thrombus. Now, the key word there is antemortem. It means before death. This isn't some clot that formed after the heart stopped beating. No, this is the very thing that caused it to stop. This is the smoking gun.
Finding this tiny killer takes incredible precision. The coronary arteries are carefully sliced into cross-sections, just 2 or 3 millimeters apart, again and again, all the way down their length. It is a painstaking, meticulous search because the one tiny clot that caused all this can be incredibly small and easy to miss.
And you know, experienced investigators even know the most likely place to find their suspect. Decades of data show that the most common crime scene for a fatal thrombus is right around the first centimeter of the left coronary artery. So that's always the first place they look.
This quote points to another really critical and sadly often overlooked checkpoint, the sinuses of Valsalva.
These are just little pockets, right, where the coronary arteries connect to the aorta. A congenital defect here can cause the opening to an artery to get pinched shut, leading to sudden death, especially in young athletes. It's a vital spot to check that's surprisingly easy to miss.
What if the cause of death wasn't a problem in the heart? What if the killer was a traveler, a clot that formed somewhere else in the body entirely and then journeyed to a fatal destination? This part of the investigation is all about finding those hidden dangers.
You know, one of the most critical forensic skills is being able to tell the difference between a killer clot and one that just formed harmlessly after death. A true antemortem thrombus is firm, it's dry, and it's literally stuck to the wall of the vessel. A postmortem clot, on the other hand, is soft, wet, and comes away easily. It sometimes has this chicken fat or currant jelly look. Getting this right is everything. It's the difference between finding the cause of death and getting completely misled.
So if a big clot is found blocking the pulmonary artery, that's a pulmonary embolism. The whole investigation suddenly gets a lot bigger. Now has to play detective and trace that clot all the way back to where it came from, which is very often a deep vein in the legs, thighs, or pelvis.
But what about a killer you can't even see? An air embolism can be instantly fatal but leaves almost no trace. So there's this simple but honestly brilliant test to find it. The pericardial sac is filled with water, and then the right ventricle is punctured while it's underwater. If a stream of bubbles escapes, that's definitive proof. Air got into the bloodstream and fatally blocked the heart.
And in the end, the heart tells its complete story. The final report pieces all of this evidence together. Hardened arteries, weak spots in the aorta, damaged valves, even signs of chronic diseases from long ago, like the unique tree bark appearance inside the aorta that can be caused by syphilis. It's a full picture of a lifetime of use and damage and disease.
So, you see, this whole forensic investigation is so much more than a medical procedure. It's really an act of translation. The story of a life and its final critical moments is written right there in the muscle of the heart. And to be able to read that story, well, it takes this incredible combination of skill, patience, and some very methodical detective work.